Every industrialized nation in the world, except the United States, has national health care. Nearly 50 million people have no health insurance, and millions that do have lousy coverage with large co-payments, forcing some to choose between food and medicine. Health care is a right, but to get it, we must fight for it. Join ACT UP, the AIDS Coalition to Unleash Power, on its 20th anniversary to march on Wall Street demanding real universal national health care and drug price controls. Assemble near the Federal Building at Broadway and Worth Streets in Manhattan on Thursday, March 29th. Gather at 11:30 a.m. Permitted march kicks off at noon. ACT UP actions helped revolutionize the drug approval process. Now it's time to fight for health care for all. For information, call 212-966-4873 or go to actupny.org. That's 212-966-4873. Welcome to a special joint edition of Out FM and the Battle for Progressive Media. I'm today's host, John Riley. Out FM is a progressive lesbian, gay, bisexual, and transgender news, culture, and activist radio hour on listener-sponsored, non-commercial WBAI New York 99.5 FM and on the internet at www.wbai.org. The Battle for Progressive Media is a television program that normally looks at media issues, but sometimes covers important stories that are underreported by the mainstream, which tends to only cover things from a corporate point of view. Today we're going to be talking about the struggle for national health care. This issue is of great personal importance to me. I currently work with ACT UP, the AIDS Coalition to Unleash Power, and we're launching a campaign to try to get real universal national health care. First, we're going to take you back in time to an ACT UP demonstration in 1988. The clip is of a speech that gave an accurate sort of feel for what it was like for a person with AIDS in 1988. The clip is from Vito Russo, who was very famous for his book, The Celluloid Closet, which discusses the portrayal of homosexuality in Hollywood for decades. The speech was filmed outside of the Department of Health and Human Resources in Washington, D.C. It was also given in Albany, New York in that same May of 1988.
AIDS in this country is like living in the Twilight Zone. Living with AIDS is like living through a war which is happening only for those people who happen to be in the trenches. Every time a shell explodes, you look around and you discover that you've lost more of your friends. But nobody else notices. It isn't happening to them. They're walking the streets as though we weren't living through some sort of nightmare. And only you can hear the screams of the people who are dying and their cries for help. No one else seems to be noticing. And it's worse than a war, because during the war, people are united in a shared experience. This war has not united us, it's divided us. It's separated those of us with AIDS and those of us who fight for people with AIDS from the rest of the population. 2.5 years ago, I picked up Life magazine, and I read an editorial which said, "It's time to pay attention because this disease is now beginning to strike the rest of us." It was as if I wasn't the one holding the magazine in my hand. And since then, nothing has changed to alter the perception that AIDS is not happening to the real people in this country. It's not happening to us in the United States, it's happening to them. To the disposable populations of fags and junkies who deserve what they get. The media tells them that they don't have to care because the people who really matter are not in danger. Twice, 3 times, 4 times, the New York Times has published editorials saying, "Don't panic yet over AIDS." It still hasn't entered the general population, and the days and the months and the years pass by, and they don't spend those days and nights and months and years trying to figure out how to get hold of the latest experimental drug and which dose to take it at and in what combination with other drugs and from what source and how are you going to pay for it and where are you going to get it, because it isn't happening to them. And they don't have their houses burned down by bigots and morons. They watch it on the news and they have dinner and they go to bed because it isn't happening to them. And they don't spend their waking hours going from hospital room to hospital room and watching the people that they love die slowly of neglect and bigotry. because it isn't happening to them. They haven't been to 2 funerals a week for the last 3 or 4 or 5 years. So they don't give a because it's not happening to them. Meaning that it isn't happening to people like them, the real people, the world-famous general public we all keep hearing about. Legionnaire's disease was happening to them because it hit people who looked like them, who sounded like them, who were the same color as them. AIDS is really a test of us as a people. When future generations ask what we did in this crisis, we're going to have to tell them that we were out here today. And we have to leave a legacy to those generations of people who will come after us. Someday the AIDS crisis will be over. Remember that. And when that day comes, when that day has come and gone, there will be people alive on this earth, gay people and straight people, men and women, black and white, who will hear the story that once there was a terrible disease in this country and all over the world, and that a brave group of people stood up and fought, and in some cases gave their lives so that other people might live and be free. So I'm proud to be with my friends today and the people I love, because I think you're all heroes, and I'm glad to be part of this fight. But to borrow a phrase from Michael Callan's song, all we have is love right now. What we don't have is time. In a lot of ways, AIDS activists are like those doctors out there. They're so busy putting out fires and taking care of people on respirators that they don't have the time to take care of all the sick people. We're so busy putting out fires right now that we don't have the time to talk to each other and strategize and plan for the next wave and the next day and the next month and the next week and the next year. And we're going to have to find the time to do that in the next few months. We have to commit ourselves to doing that. And then after we kick out of this disease, we're all going to be alive to kick out of this system so that this never happens again.
That speech was given at the Department of Health and Human Services in Washington, D.C. in 1988 by Vito Russo, who died of AIDS in 1990. Eric Sawyer, one of the founders of ACT UP New York, the AIDS Coalition to Unleash Power, joins us in studio. ACT UP is a direct action group whose efforts revolutionize the drug approval process by greatly speeding it up. ACT UP was also key in securing a social safety net for people with HIV/AIDS at a time when people were dying so fast they couldn't qualify for benefits in time to use them. ACT UP is known for its mass direct actions, such as the takeovers of the Food and Drug Administration and the National Institutes of Health in the late 1980s and early 90s. We're also joined in the studio with Ajamu Sankofa from Healthcare Now, a national grassroots coalition of individuals and organizations supporting a single-payer plan for health insurance. Eric, as a person living with AIDS, do you still see the epidemic as though it were a war?
I definitely do see the epidemic still as it's a war, and that's mainly because people with AIDS are still fighting for their own lives and for the lives of other people living with AIDS. We have seen some improvements in this country with regard to attaining safety nets to help provide care and support for people living with AIDS, and the advent of triple therapy has allowed people like myself to live for decades with relative health with HIV and AIDS, but people in the developing world who don't have our access to those treatments are still dying rapid, unnecessary deaths.
How do you react to Vito Russo's speech ending with the comment about kicking the crap out of a system that's treated us in this way?
I think they're really appropriate. I think they were the words of a prophet. Vito foresaw that there would be a continued crisis to get access for health care on this planet, and our attempts to provide support and medical care and health care to people with AIDS took a approach to get specialty care and services through exceptions to policy where people with AIDS got special access to Medicaid cards and food stamps and housing allowances to try to save their lives, because the plight of people with AIDS was so severe. And what Vito was alluding to was at that time we got systems that we needed to care for ourselves through exceptionalism, and the hope was that we would stay alive long enough to come back and kick the crap out of a system that was denying basic rights to everyone. And so we're back now to, instead of pursue Band-Aid approaches like all of the AIDS-specific programs for health care and housing and income support we obtained, we're now working for universal access to health care. We're trying to engage in systemic surgery against a system that is failing the most needy.
Ajamu Sankofa, can you tell us what's the situation like nationally for people that have serious diseases that isn't AIDS right now? Like, how is the healthcare system treating them? How is it failing them? How is it, can you talk about the general situation?
Sure. The healthcare system in this country has failed very, very severely. The cost of health insurance has skyrocketed such that middle-class people are becoming bankrupt and are becoming impoverished just to be able to qualify for some modicum of care through the Medicaid system. You have the current Medicare and Medicaid system simply inadequate to provide care, and folks are falling through the so-called social safety nets. And then there's this issue of just simply healthcare insecurity, just the fear and the trauma that comes in people's lives from not knowing whether or not they can afford healthcare or even have it when they have a serious condition. I think the most onerous aspect of the failed system is that lives can be saved if everyone had adequate health care from cradle to grave, just as they have in the other Western developed countries. You have nearly 20,000 people dying every year for no reason other than they have no health insurance. So that's an abomination, and it would qualify as a crime against humanity.
What constitutes real reform?
Real reform is the fundamental understanding that health care is a fundamental human right. That would be real reform in this country, to expand and defend people's right to health care as a human right. That is, you would have from cradle to grave health insurance that would provide adequate health coverage and access to health care for everybody. That would be adequate reform. Anything else is piecemeal, and to the extent that private health insurance companies remain in the system, then you will have a failed system, because you have the contradiction between profit and satisfying people's need to health care.
Every industrialized nation in the world has a national health care plan, except for the United States. In recent weeks, national health care has been hitting the national agenda for all Americans, gay or straight, through the upcoming 2008 presidential election. This problem is so grave that even big business can't afford to ignore it. Faced with a globalized economy and industrialized nations in Europe offering stiff competition because their workers have more efficient health care, even Wall Street now must take pause and consider how to handle this crisis. For those that are 20 years old or haven't followed current events very much, healthcare reform started in 1994, in the most recent period, when a coalition of Republicans, along with a few right-wing Democrats, defeated an attempt to bring some kind of healthcare reform to completion. The plan was defeated by an ad campaign launched by small business companies, which were being edged out by larger ones in a plan that was strongly supported by Hillary Clinton. But that wasn't the first plan to be defeated by the Republicans. Earlier in the late 40s, President Truman had proposed a sweeping national healthcare system that was also defeated by use of the terminology socialized medicine. This year, the presidential candidates are being quizzed about their plans. Recently, on Face the Nation, John Edwards was asked about his plan.
Can we finally say we stand now and forever for every single man, woman, and child in America having health care, universal health care. We will leave no one behind. We will not allow a single family or a single child in America to not have health care coverage and to not have the health care that they need and deserve.
Universal health care, noble goal, but that's 47 million more men, women, and children. How much would that cost, and what kind of plan would you propose?
Costs between 90 and 120 billion a year once it's fully implemented. I will, on this show and tomorrow, be laying out details of a universal health care plan. Basically, we start with the problem, which we want to make sure that the 47 million people who don't have health care coverage are covered immediately. Second, we want to deal with the costs that middle-class families who may have health care coverage but are worried about paying for it, worried about keeping it. Premiums are up 90%, literally 90% just over the last few years. So we want to do something to bring costs down for others. And we want to create some efficiencies that allow competition. And then finally, here's the bottom line. We want to make sure everybody's covered. We want to help middle-class families with the costs. We want to try to create competition that doesn't exist today. And I think the most effective way to do that, which is what my plan will be as I lay it out tomorrow, is we take the 47 million people who don't have health care coverage. We expand Medicaid. We provide subsidies for people who don't have coverage. We ask employers to play a bigger role, which means they either have to have coverage or they have to buy into what we're calling health markets. We're going to create health markets all across the country, which will help provide some of these efficiencies. One of the choices, by the way, available in these health markets is the government plan. So people who like the idea of a single-payer health insurance plan, that is actually one of the alternatives that people can choose. They'll be allowed to choose. We expand S-CHIP. We expand Medicaid. The bottom line is we're asking everybody to share in the responsibility of making health care work in this country. Employers, those who are in the medical insurance business, employees, the American people, everyone will have to contribute in order to make this work.
Would you be willing to raise taxes in order to help pay for this?
Yes, we'll have to raise taxes.
Ajamu Sankofa of Healthcare Now. Employer mandates, employee mandates, tax breaks, single payer, it's enough to give you brain fog. Edwards said it all. Is this real reform? What do these terms really mean?
To try to simplify what Edwards is saying, which is fairly complicated, the way he's presenting it, is this, that he's talking about a limited expansion of the current Medicare system without any improvements within that Medicare system. And he's also talking about maintaining the role of the private health insurance companies in the system. What does this mean in practice? In practice, it means that the people who are the most sick will not have access to the private health insurance industries because they routinely deny Medicare patients. And so you'll have people who are reasonably well and can afford care go into the private health insurance industry, and costs, therefore, will continue going up. And then you have the sickest people in the country being stuck with a rather poorly configured Medicare system because it doesn't provide, the kind of drug coverage and dental coverage, mental health coverage that an expanded and improved Medicare system would provide. So it's a complicated set of blue smoke and mirrors. The positive piece here is that the presidential candidates are beginning to talk about this issue a little bit more thoughtfully as a result of the existence of a grassroots movement demanding a single-payer system.
We're going to go to another clip where Edwards elucidates a little bit more about his health care plan.
Medicare has very serious short-term intense financial problems. And there are things we can do that we're not doing, we ought to have much better chronic care management than we have today. We ought to be investing in a serious and systemic way in preventative care, which we're not doing today. And we have significant fraud and abuse in the Medicare system. Every study that's been done demonstrates that. So I think there are things we can do to strengthen Medicare, and we ought to be using, like, for example, in my universal health care plan, we create these health markets which require providers to compete against each other. We ought to be using the power of the federal government to negotiate better prices in Medicare. And it was a foolish thing in the Medicare prescription drug law that was passed, which I voted against, to not allow the government to use its market power to negotiate better prices. And
so, Ajamu, how do you react to the charges of fraud and abuse in the current Medicare system?
Understanding that the real incentives for fraud and abuse exist because of the existence of the private insurance companies' involvement in delivery of health services in this country. That, and in fact, I'm reluctant to spend a lot of time responding to the complexities and almost inanities of the Edwards plan and not talk about the power of the John Conyers plan, H.R. 676, which is a very simple to understand and simple to explain reform of the healthcare system in this country. The government will be the single payer. The revenues will come out of the taxes. There will be total freedom of choice of providers, of health providers, and that there will be a 5% reduction in the overall cost of the system, so there's no additional outpouring of revenue. And the way that the revenue will be gathered will be through a progressive tax system and also the huge amount of money that's already in the pool that's paying for Medicare and Medicaid. That's where we have to go. We can't mix and match. If people take the time to read the bill, H.R. 676, there's ample oversight structures to deal with fraud and abuse and decision-making with regard to how charges are meted out.
So, Eric, can you talk about drug price control? Edwards briefly mentions it, but his idea is, I think, different than what ACT UP's idea. Can you talk about it?
Significance of drug pricing control is actually tied to the huge percentage that the price of prescription drug represents in the national health care budget. Of the largest single item in terms of dollars spent on health care in this country is prescription drug purchases. Edwards talked about voting against a Medicaid Reform Act dealing with prescription drug coverage, and that is one of the most classic cases of smoke and mirrors that we've ever seen. It basically was corporate welfare by the federal government, two big pharmaceutical companies, allowing them to basically set the price for their name brand drugs and waiving our government's right to negotiate discount drug prices in purchasing through the Medicaid system. That is contrary to what any other nationalized democratic government does in places like Canada, Australia, the European Union. Their governments do bulk purchasing of drugs for their citizens at dramatically reduced prices. They pay a fraction of the price that we pay for drugs here in this country, and what that amounts to is huge reductions in the total dollar spent for health care in their country. Instead of talking about how we have to increase taxes to pay for health care delivery, we need to be looking at inefficiencies in the systems and the overprice we pay, the excessive prices that we pay to allow drug companies to profiteer is one of the biggest things that we should be looking at. If we eliminated that fraud, in my opinion, of their excessive charges, we wouldn't have to talk so much about raising taxes to pay for health care. There are a number of ways that we can capture efficiencies and reduce prices for our national health care budgets, and one of the best ways would be to negotiate bulk purchasing of all pharmaceuticals through the U.S. government through a nationalized health care program.
And any further drug price control? Would they be required to open their books and prove what it actually costs to produce these drugs?
I think it would be really helpful if we called for, transparency in the pharmaceutical production. What we hear and what we see just from looking at documents like SEC filings and annual reports that are produced by big pharma companies themselves is totally different than the spin they put in the media. those documents show that on average 12 to 15% is actually spent on development, R&D for new drugs. Similarly, those documents show that 30 to 40% is often spent on marketing and promotion. Another huge percentage, probably in the vicinity of 25 to 30% of their gross revenue, goes for shareholder return and also for executive compensation. The huge price of drugs in this country is not going to develop new drugs or even for the cost of producing the drugs. We've seen that, for example, AIDS drugs, the Clinton Foundation has negotiated triple cocktails that cost, in the vicinity of $100 per person per year, while Big Pharma charges Americans for name brand drugs tens of thousands of dollars for triple therapy per year. And that shows that the actual cost of producing those drugs, reflected by the generic pricing, is literally pennies per pill, and that drug companies are literally charging tens of dollars for name brand medication. That profiteering has got to stop because it's bankrupting the American government, and it will bankrupt the American Medicaid system when the baby boomers retire, and it's literally going to bring our economy in this country to insolvency.
How are we going to actually get to that kind of a system? Can you address that?
I think the decisive process is a mass-based movement that's patterned after the civil rights movement. This is a fundamental human rights issue. And, probably 5 or 6 years ago, I would have been more cynical with respect to the ability to transform this system and to win a national single-payer system in this country. Well, my view of that has changed dramatically based on the response of people throughout the United States for a single-payer system. And nearly 70% of the American people want it, the majority of physicians want it, a significant number of CEOs of hospitals want it. It's the right thing to do. And to the extent that we can demand from the outside and force these politicians, Democratic and Republican, to do the right thing and not accept no for an answer. And so, our organization says health care now, but in order to get health care now, we will have to act up accordingly to get that. And I think the model of activism, of ACT UP, is a tremendous learning curve for all of us involved in this movement now. And that is what it's going to take. And that's what's happening throughout the United States. It's the best kept secret, however, and that's why shows like these and others to let people know that there's a real viable movement out here to win a single-payer system.
Call 212-966-4873 or go to actupny.org. That's 212-966-4873.